Even as we see a flattening of the curve, the number of deaths, more than 700 in 24 hours. We're inside a New York City hospital, the reality, even as we reach the peak. Governor Cuomo now ordering everyone in the state to now cover your face in public and saying testing is what's desperately needed to get Americans back to work. Massachusetts death toll spiking tonight, the governor saying we are in the surge. Hundreds of Americans lining up before dawn for testing in this country with hopes of reassurance as they prepare to return to some sort of normalcy. Tonight, what will America look like in the coming weeks and months? How long will we have to keep a safe distance from one another or wear masks? Are we talking months or even into next year? And if we've been exposed to coronavirus, even without knowing, if we have antibodies, will we have immunity? All of those questions answered. My interview with Dr. Anthony Fauci right here tonight. And this evening, President Trump facing backlash for his plans to halt funding to the World Health Organization. Late today, our exclusive interview with Bill and Melinda Gates told me about the president's move as they make news on another front right here tonight. There is also news this evening in the race to find a vaccine. We are tracking the human trials underway in this country. Is there any way to speed up the process? The doctors and scientists at work in Philadelphia and Washington State, and the urgent effort to come up with an accurate test for antibodies. What Diane Sawyer has learned tonight as we now hear from one young man who, like so many Americans, remembered symptoms weeks ago and thought he might have had the virus. What the test showed, and does he have immunity? And overseas tonight, some countries now taking their first steps to reopen. The images tonight from inside schools, one child to a table. And now the second wave of cases being seen, what to expect right here at home.
This is ABC World News Tonight with David Muir.
Good evening, and it's great to have you with us here on a Wednesday night. And we begin tonight with the questions so many Americans are asking. How soon will parts of the country reopen, and what will it look like when it does? President Trump moments ago saying he will unveil national guidelines tomorrow on how to reopen the country. But right here tonight, my interview with Dr. Anthony Fauci about what this country will look like, a reality check on what we will all have to do in the weeks and months to come. All of this as the death toll in the U.S. approaches 28,000, 2,500 deaths in the last 24 hours alone. Nearly a third of those deaths in New York, 752 in the past day, the 8th day above 700, a flattening of the curve, but as you can see, at a devastating level. And tonight, Governor Andrew Cuomo now ordering the wearing of masks to keep the virus in check. The peak they hope has been reached here, and tonight other parts of the country still have not reached their apex. More than 17 million Americans out of work. New numbers coming tomorrow, that number expected to spike again. The first stimulus checks arriving tonight. And the global firestorm tonight after President Trump revealed his plans to halt funding to the World Health Organization in the middle of this global pandemic. Our exclusive interview with Bill and Melinda Gates tonight, their reaction to the president's move, what they told me as they make news tonight themselves. Their big announcement right here. We will carefully get to it all, and we begin with ABC's Tom Llamas right here in New York.
Tonight, the relentless battle against the coronavirus. Even as New York flattens the curve, the death toll is rising. 752 people dying in just the past 24 hours. At Mount Sinai Beth Israel Hospital, Dr. Eric Eiting has been working the overnight shift.
We're seeing plenty of coronavirus cases, some people as young as in their 20s, and people as old as in their 80s.
This week, the hospital reversing its policies to allow some families time with their loved ones.
We decided to change it for patients where they're very near the end of life, so that people don't have to die alone.
And today, New York Governor Andrew Cuomo issuing an executive order requiring everyone to start wearing face coverings in public. In Massachusetts, the governor announcing deaths in the state now topping 1,000.
And I would say at this point in time that we are in the surge, yes.
And in Miami, a line of cars snaking around Hard Rock Stadium, hundreds showing up to be tested. But for many, the wait ending in disappointment. The facility can only perform 700 tests a day.
I came here yesterday, I couldn't do it, so I have to come back today.
And tonight, a growing consensus that stepped-up testing is the key to putting America back to work.
The more testing, the more open the economy. But there's not enough national capacity to do this. I'm telling you, we can't do it without federal support.
Today, the Wall Street Journal reporting that President Trump on a conference call was urged by executives on his recovery task force to dramatically increase testing capability in order to get the economy going. For the people waiting in unemployment lines in Florida and converging on food pantries in Phoenix, it can't come soon enough. Outside San Francisco, Nick Stanford, now unemployed, is pinching pennies at the grocery store.
We're barely scraping by, and we're getting behind. We're struggling. And
President Trump has yet to release federal guidance on how the country might reopen, and today facing backlash over his decision to strip funding from the World Health Organization.
The WHO failed in this basic duty and must be held accountable.
Today, an outcry in some circles, from the American Nurses Association, which called the move misguided, to Bill and Melinda Gates, who have donated millions to the fight against COVID-19 and sat down with David Muir for an exclusive interview.
I wanted to ask you, Bill, we've reported here in the last 24 hours the president revealing that he wants to halt all U.S. aid to the World Health Organization. Do you agree with that move?
Well, I'm hopeful that he doesn't follow through on that, because we need their support. This is a global problem. They are the institution that brings nations together and make sure that that we're sharing best practices between all of those countries. There'll be plenty of time to look back and see which countries did things well, which didn't. Where should WHO have done things differently?
Have you tried to reach out to the president on this?
We did tweet our support for the WHO. We don't think they should have to start letting people go in the middle of the first modern pandemic.
WHO was created after World War II to deal with exactly these kinds of issues around the world. So halting funding right now, that just doesn't make any sense.
And David, the president says tomorrow at a news conference he's going to release a plan for all 50 states to open. It's going to be the president's guidelines. We'll have to wait and see what he says. David?
Tom Llamas tonight. Tom, thank you. And of course, we'll hear more from Bill and Melinda Gates in just a moment. But many of you at home simply want to know how and when will we reopen this country as we continue our series of reporting on what's next for America. Tonight, your questions: are we ready to reopen? Are they ready with tests to reassure us before we re-enter society, return to work or school? And can you catch this virus twice? The new headlines tonight. We get to all of those questions with this country's leading expert on infectious diseases, Dr. Anthony Fauci, who I spoke with before we came on the air tonight. Dr. Fauci, thanks for joining us here. And I know that everyone at home really just wants to know, when will America reopen? How will America reopen? We've heard from the president that in some places it will reopen perhaps after these 30 days, in some states even sooner. Do you agree with that? Is America ready to reopen?
I think we need to be careful, David, to make sure that we don't talk about America in totality, because there are so many different levels of outbreak and of involvement with this virus throughout the country, that there will be some areas of the country which will really be much more attuned to and ready to be able to get more towards normality than others. I kind of refer to it as kind of a rolling re-entry, so that it's not going to be like a light switch that you turn on and off and say, on this date, America will resume its normal activities.
So regardless of time frame here, because you say it'll be a different time frame for different regions of the country, but regardless of the time frame, what needs to happen in order to reopen?
What you must be able to do is to have in place the capability of rapidly identifying by testing, getting someone who's infected out of the circulation, obviously taken care of if they need medical help, if they can be handled at home, do contact tracing, do it in an efficient way where it means something, not contact tracing many days after an individual actually is exposed.
Dr. Fauci, you've talked a lot about testing and tracing, that is a necessary component here. And with all due respect, the American public watched weeks ago when testing was really important in this, and the very slow ramp up. How do you convince them that we're going to be ready to test all over again to try to reopen this country? May 1st is just a couple of weeks away.
So, David, what I am hearing and seeing from the parties involved that are responsible for the upticking of the tests, making them available, is that we are doing extraordinarily better now than we were at the time when there really were some significant challenges.
Are you telling us that there'll be tens of millions of tests ready so that American families can feel confident about leaving their homes and going back out in the public and re-entering society?
David, I can't guarantee that, and I can't tell you that for sure. What I'm hearing from the people responsible for making sure these get out there is that we will have, and it's not only just the federal government doing it, it's the private enterprise, it's the companies that are able to make and implement these tests.
Dr. Fauci, is there going to be a second wave of infection in this country?
We don't know that. I mean, I think we just have to be humble to realize that we do not know everything about this virus and what it's capable of doing. It is entirely conceivable that we will see a rebound as we get into a seasonal situation, such as next fall or winter.
You know, in the meantime, I know you're aware of these reports out of South Korea and even some anecdotal reports here in the U.S. of people coming down with this twice. Do we have any idea whether or not these cases are new infections or a reactivation of coronavirus already in the system? Are you concerned about that?
Well, David, I can tell you we do not know definitively whether these are reactivations or whether they are reinfections. You know, and also not only that, are these really rare outlier events, or is this something that is telling us something about the degree of protection? It's a challenge to find that out. The critical issue that's related to that people are asking, and it's important, is that when you are infected and you have an antibody, which is a protein that essentially fights the virus, and you have a level of antibody in you, are you protected? Namely, are you protected for a month, 3 months, 6 months, a year? Those are things that we have to find out, but we don't have the answers to that right now.
We know there's a handful of human trials underway for vaccines. You have said 18 months repeatedly. Is there any way to try to speed this up?
You know, the answer is yes, but not substantially unless you have certain conditions. In order to be able to get a vaccine that you feel comfortable will be safe, and I say not only safe 15 minutes after you inject someone, that you don't get sort of an allergic reaction, but safe in that it does not, if a person gets infected, actually make it worse. We may learn a bit earlier, a few months earlier, but I think any less than a year, I think anything less than that would be carving off a couple of months, but not a lot more.
So that essentially, Dr. Fauci, takes us right into next winter. And I know a lot of people watching, you know, are concerned about their parents, their grandparents. Does that mean we're going to have to be awfully careful with them and perhaps keep a distance from them all the way through, you know, next January, February, given the timeline you just gave me?
David, if we get a rebound of virus in the community, which, as I said, is possible, it may not happen, but it's possible. If we do, and we don't have an effective and safe vaccine available, we will have to resort to the public health measures that have really fared us really rather well in many respects in the challenge we're going through right now.
A very long road ahead. I also asked Dr. Fauci about antibody tests. He says when you have antibodies that develop in response to an infection, generally speaking, with few exceptions, you do have some immunity. Now, whether that's true here and for how long, he says, remains unclear. So tonight we move on here to the race to come up with a vaccine and, of course, an accurate antibody test. And Diane Sawyer's team on a new trial and the young man who thought he remembered some symptoms several weeks back. What the antibody test showed. Here's Matt Gutman.
Tonight, injection by careful injection, the race is on to find a viable vaccine for COVID-19. In Washington state, the initial epicenter of the crisis, Neil Browning volunteered for the trial.
I feel like it's all of our jobs as human beings to step up and help out the rest of mankind.
The other race tonight, the search for antibodies. In Michigan, the nation's largest testing is underway. 38,000 Beaumont Health System employees asked to take part. Lab manager Tyler had a high fever back in February, but was it the coronavirus? He told our Diane Sawyer he tested positive for COVID antibodies.
What kind of relief did you feel when you heard this?
It's kind of like a little bit of a weight got lifted, just because there are so many people that are getting affected by this that it's just nice to know that I somehow got through it without too much issue.
But Tyler still waiting to find out if he is now immune to the virus, one of the keys to restarting the country.
Are you doing a preview of what it will be like to get a huge population back into their lives, back into the future?
You know, that's what we hope to do with this. You know, part of the goal of this is to figure out how to get people back to work, how to get people back to a relatively normal life.
And David, some good news from Neil, that vaccine trial patient. He tells us so far he has had no side effects. David.
They are very hopeful about this, Matt. Thank you. And overseas tonight, some European nations taking those first steps to slowly reopen. In Germany tonight, some small stores will open next week, then schools will follow next month. And students are back in the classroom in Denmark today, but look at this, just one child per table. And of course, there are fears of a second wave, not only here at home. China is now reporting those new infections this month, but they say the vast majority are from Chinese nationals returning to their country. When we come back here tonight, Bill and Melinda Gates, big news tonight from them and what they told me about the 3 major phases they see coming in this country for so many of us.
Now more than ever, we need the good stuff in life. Togetherness, patience, laughter, love. Milk. Love what's real.
People used to care. Heck, they'd come all the way out here just for a blurry photo of me.
Oh, that's a good one.
Wait, what's that?
That's just a low battery warning.
Oh, right.
Now it's all, check out my RV and let's go four-wheeling. Maybe there's a little part of me that wanted to be seen.
Well, Progressive helps people save when they bundle their home with their outdoor vehicles, so they've got other things to do now, Bigfoot.
Wait, what did you just call me?
Bigfoot?
My name is Daryl.
Smoking damaged my heart. Now I have a battery-operated heart pump. My tip is, stop thinking this can only happen when you get old. My heart failure happened at 38.
You can quit. For free help, call 1-800-QUIT-NOW.